Please subscribe to Healthy Life at 60 to receive more trustworthy health advice. Did you know that up to 8 out of 10 diabetics over 50 have a silent deficit of a single vitamin? It's a key vitamin for insulin to function correctly. Yes, that very insulin that, when it's not working, allows your glucose to spike, even if you're eating well. It sometimes feels like we're doing everything possible, doesn't it? We take care of ourselves, follow the instructions, but the sugar levels still act up. My name is Dr. Andrew Thompson. I'm a family doctor, and I've been helping my patients control their diabetes for over 15 years. I search for solutions that don't just add to the list of medications, but actually optimize what they're already doing. And believe me, I've seen it all. Today, my mission is to reveal to you, with scientific studies and my clinical experience as backup, which 3 vitamins have a real impact on reducing blood sugar. More importantly, I will show you how to take them safely and effectively. If you can stay with me until the end of this video, you'll get a step-by-step 4-week mini protocol. This protocol is already transforming the lives of thousands of my patients. So take a deep breath, relax for a moment. What you're about to learn today can save you not only those annoying sugar highs and lows that steal your energy, but also, and this is the most valuable part, a significant medical scare or two. Are you ready to turn around your glycemic control? Let's get to it. Why does my control fail when I'm doing everything right? It's a story I hear almost every day in my clinic. Doctor, I just don't understand. I do everything I'm told. I follow the diet to the letter. I inject my insulin or take my pill religiously, but my HbA1c is still stuck at 8.5% or even going up. It's frustrating, I know, and it's natural that the first thing we think of is our diet. Am I eating something wrong? Then stress, which we know throws everything out of whack. And of course, weight, which is always present in the conversation. But let me tell you, there is very often a fourth factor, one that is almost invisible, a true silent saboteur, the deficiency of essential micronutrients. Imagine this. Insulin, whether it's produced by your pancreas or the insulin you inject, is like a key. Its job is to open the door of your cells so that glucose, the fuel, can enter and be used as energy. Now that door has a lock, the insulin receptors. And here's the interesting part. For the key to turn smoothly in the lock, we need a lubricant. That lubricant consists of certain vitamins and minerals. If that lubricant is missing, if there is a deficiency of these key micronutrients, the key simply cannot turn well. The cell's door doesn't open easily. And what happens then? The glucose stays floating in the blood, causing your levels to spike. Repeating this process month after month, year after year, is incredibly exhausting for your pancreas, which strains to produce more insulin in vain. It worsens insulin resistance, meaning you need more and more medicine, and it speeds up the path towards serious diabetes complications. It's a vicious cycle that we must break. The external lab results I receive from patients who come to my clinic looking for answers show a clear pattern again and again. Diabetics, especially older adults, have significantly lower levels of vitamin D, vitamin E, and magnesium than the general population. Why does this happen? The reasons are multiple and interconnected. First, when blood glucose is chronically high, our kidneys work overtime, and in doing so, they eliminate more minerals and vitamins through urine. It's as if the body, in its attempt to get rid of excess sugar, also drags out good things. Second, and this is crucial, some diabetes medications, such as metformin, although wonderful and necessary, have a known side effect. They reduce the absorption of certain vitamins like B12, and to a lesser extent D. Third, as the years go by, our intestine ages. Like many other parts of the body, it is no longer as efficient at extracting all the nutrients from the food we consume. Add to this that many people avoid the sun, our main source of vitamin D, for fear of sunstroke or due to medical recommendations. Plus, red meat, an excellent source of vitamin E, is often restricted in healthy diets due to cholesterol concerns. The result is a cocktail of hidden deficiencies that, without us knowing it, are sabotaging even the best therapeutic plan for diabetes. The wonderful news is that correcting these deficits doesn't require expensive drugs or complicated shock protocols that turn your life upside down. With dosages adjusted to your needs, without dangerous interactions with your current medication. And of course, always under medical supervision, we can see amazing results. In fact, it is common to observe a drop in fasting glucose of between 15 and 25 mg/dl in just a few weeks. Imagine the impact. Let's start with the star, what I consider the master key. Vitamin 1, vitamin D3. Vitamin D3, my friends, is not just the bone vitamin, although it is, of course, essential for them. It is much more than that. I call it the hormone vitamin because it acts as a true orchestra conductor in our body, turning over 1,000 genes on and off. And among them, guess which ones? Yes, the ones that make the glucose transporters, those that help sugar enter the cells. It is a fundamental pillar in cellular communication. And what does science say? A meta-analysis published in 2023 that combined the results of 46 robust clinical trials showed conclusively that supplementing with daily doses of 1,000 to 4,000 international units, IU, of vitamin D3 can reduce HbA1c by an average of 0.32 points and basal glucose by about 10 mg/dl. These are not small numbers. These are changes that make a real difference to your health. In my own clinical experience, I have observed that older adults who manage to maintain their 25-O-D levels between 30 and 50 ng/ml not only need fewer units of insulin, but also experience far fewer glucose spikes after eating. Their control is simply more stable and predictable. Now, the million-dollar question: how do you know if you are deficient in this crucial vitamin? Often, the deficit manifests with silent signs that we usually put down to age or tiredness. A very common one is muscle fatigue, that feeling that it's hard to get up from a chair as if your muscles don't have the strength they used to. You may also experience night cramps in your calves or those annoying involuntary contractions in your fingers or toes. But the most reliable method, of course, is a blood test. Ask your doctor for the 25-OD test. If the result is below 20 ng/ml, we're talking about a severe deficit. If it is between 20 and 29 ng/ml, you have an insufficiency. With that data in hand, we can calculate the precise dose for you. Generally, 2,000 IU a day for a couple of months is enough to replenish levels, and then you can maintain them with 1,000 IU daily. An important detail: if you have obesity, your need for vitamin D3 may be almost double. Why? Because vitamin D is fat-soluble, it hides in body fat and is not as readily available in the blood to perform its functions. Where do we get vitamin D from? Fatty fish, salmon, sardines, mackerel, egg yolk, and sun-exposed shiitake mushrooms are sources. But let's be realistic. To reach that 2,000 IU daily, you would have to eat something like 200 g of salmon every day, which is impractical and unfeasible for many. Therefore, capsule supplementation is usually the most reliable and consistent option. I recommend looking for vitamin D3 dissolved in olive oil or another oil, not in powder form. The reason is simple: it is absorbed up to 30% better. And a trick: always take it with food that contains some fat. If your breakfast is fat-free, then switch it to lunch to maximize absorption. A few words of caution, because safety comes first. If you have any kidney disease or if you take thiazide diuretics, it is essential that you inform your doctor before starting to supplement. Vitamin D increases calcium absorption, and in cases of renal damage, this could raise blood calcium levels to dangerous levels. The safe limit for most people is 4,000 IU a day. And please, do not get carried away by megavitamin doses of 10,000 IU or more without very close medical supervision. More is not always better. In this case, an uncontrolled excess of vitamin D could, paradoxically, calcify blood vessels and soft tissues, which is the last thing we want. After about 8 weeks of supplementation, I encourage you to repeat the 25-OD blood test. If you are already in the optimal range, I assure you that you will begin to notice a big difference. Less post-meal sleepiness, that heaviness after eating. A noticeable improvement in your mood, because vitamin D also regulates serotonin, the happiness hormone, and what interests us most here, much more stable sugar levels. Now that the master key is working at full capacity, it's time to reinforce the lock with a powerful antioxidant. Vitamin 2, mixed natural vitamin E. Vitamin E is a real treasure, but you have to choose it well. It is not a single molecule, it is an entire family. It is composed of 8 distinct molecules, 4 tocopherols, alpha, beta, gamma, delta, and 4 tocotrienols. The problem I see with many cheap supplements on the market is that they only contain synthetic alpha-tocopherol. This is a mistake, because taking only one of these forms can displace the others, drastically reducing the efficacy and the broad spectrum of benefits that natural vitamin E offers. Recent studies in diabetics, including one from 2022, have shown that a dose of 200 mg a day of mixed natural vitamin E, that is, with all its forms, can reduce fasting glucose between 8 and 12 mg/dl. Even more importantly, it decreases markers of oxidative stress, such as malondialdehyde, by up to 25%. That is a significant reduction. You might ask, why should we care so much about oxidative stress? Think of it this way. Every extra glucose molecule circulating in your blood is like a sticky candy. The longer it hangs around, the more it caramelizes or glycates your proteins and blood vessels, damaging them. Free radicals are responsible for this oxidative damage. They block the insulin signal, making it even harder for sugar to enter the cells. Vitamin E, in its natural and mixed form, acts as a protective shield, neutralizing those free radicals and preventing them from breaking the essential communication between insulin and its receptors. It's like putting up a barrier to protect the integrity of your cells. How can you suspect you're lacking vitamin E? There are signals, although subtle. Dry, flaky skin that doesn't improve with moisturizers. Slow healing of minor wounds. Those that used to heal quickly now take forever. Calf cramps when walking short distances. Curiously, a loss of night visual acuity or sharpness. Another indicator, if you have access to your blood count reports, is the appearance of deformed red blood cells known as ovalocytes. If you see any of these signs, it could be a clue. Regarding the dose and form, my recommendation is to look for a supplement of 200 mg a day of mixed vitamin E containing alpha, beta, gamma, and delta tocopherols. If the supplement also includes tocotrienols, 100 mg is usually sufficient. Like vitamin D, always take it with food, because absorption improves by up to 70% in the presence of fats. And here is an important warning. Avoid capsules that promise 400 mg or more of vitamin E, especially if it is only alpha-tocopherol. High doses, especially of synthetic forms, have been associated with an increased risk of hemorrhagic stroke and can antagonize vitamin K, which is crucial for coagulation. Speaking of interactions, if you take anticoagulant medications like warfarin or antiplatelet drugs, it is absolutely vital that you notify your cardiologist before starting vitamin E. It can prolong bleeding time. It can also have a slight effect on lowering blood pressure. This can be helpful if you have hypertension, but if not, watch out for possible dizziness. What foods are rich in vitamin E? Almonds, about 7 mg per 30 g, hazelnuts, unrefined sunflower oil, avocado, and dark green leafy vegetables. If you include about 30 g of unsalted nuts in your diet daily, you are already covering almost half of the recommended dose. However, to ensure that consistency and the optimal dose, the supplement is usually more effective. In my practice, I usually combine vitamin E with vitamin C because they recycle each other, enhancing their antioxidant effects. But a crucial precaution, vitamin E improves glucose uptake by cells. If you take insulin or oral hypoglycemic agents, this means that the same dose of your medication could lower your sugar more. You must be very attentive to possible hypoglycemia. If you notice them, consult your doctor immediately so they can adjust the dosages of your hypoglycemics. Never, under any circumstances, do it on your own. With vitamin D3 and mixed natural E, you already have an elite army protecting your cell membranes and improving insulin sensitivity. But we are missing a key component, the electrical regulator that allows the muscle, that great consumer of glucose, to actually utilize it. I am referring to magnesium. Vitamin 3, elemental magnesium. Magnesium, although sometimes forgotten, is the 4th most abundant mineral in our body. And believe me, it is truly wonderful. It participates in more than 300 vital biochemical reactions. One of the most important for diabetes control is its role in the phosphorylation of the insulin receptor. What does this mean? It means that without magnesium, even if insulin reaches the cell, that key we talked about, the door simply doesn't open properly. It's as if the mechanism were jammed. It's no coincidence that a very revealing prospective study from 2021, which followed over 42,000 older adults, showed that those who ingested less than 200 mg of magnesium a day had a 37% higher risk of developing type 2 diabetes. And in those who are already diabetic, the relationship is clear and inverse. For every 1 mmol/L that serum magnesium increases in the blood, HbA1c drops by 0.23 points. This is not a coincidence. It is a direct and powerful connection. How do you know if you are deficient in magnesium? The symptoms of deficiency are varied and often nonspecific, making diagnosis difficult. Nighttime cramps, especially in the legs, are a classic sign. Other symptoms include palpitations after eating, chronic constipation, jaw contractions when chewing, as if the joint hurts, and that typical involuntary eyelid twitch or tremor when you're resting. But magnesium doesn't just affect muscles. It also plays a crucial role in your emotional well-being. A deficit can manifest as anxiety, irritability, or difficulty relaxing. This is because the mineral is a key regulator of the hypothalamus-pituitary-adrenal axis, which is our stress response system. When we talk about magnesium supplements, the variety can be overwhelming, but here are some tips. Magnesium oxide is very common and cheap, but its absorption is low and it tends to be a laxative. Magnesium citrate, on the other hand, is absorbed quite well and is an excellent option if you also suffer from constipation. If you're looking for something gentler on the digestive system and with high bioavailability, magnesium bisglycinate is a gem. It's neutral at the intestinal level and minimizes the risk of diarrhea. If you hate capsules, magnesium chloride dissolves easily in water and can be a practical alternative. The usual dose is 200 to 400 mg of elemental magnesium per day. My advice is to split it into 2 doses to reduce any potential laxative effect. Start with 200 mg the first week, and if your bowels tolerate it well, you can gradually increase it. What about food sources? They are delicious and easy to incorporate. Chia seeds, pure unsweetened cocoa, about 20 mg per tablespoon, cooked spinach, almonds, chickpeas, and mineral water rich in magnesium are excellent options. Some water brands can provide up to 110 mg per liter. If you make a smoothie with 200 ml of rich mineral water, a spoonful of pure cocoa, and a tablespoon of almond butter, you've already had almost 150 mg of magnesium without needing supplements. That's a great start. Importantly, let's discuss interactions. Proton pump inhibitors, those medications used for stomach acid like omeprazole or pantoprazole, reduce magnesium absorption by up to 60%. If you've been taking a gastric protector for over a year, you almost certainly need to supplement magnesium. Thiazide and loop diuretics, used for high blood pressure or fluid retention, also increase magnesium elimination through urine. If you take any of these, talk to your doctor to adjust the dose. A serious precaution. If your glomerular filtration rate is below 30 ml/min, that is, if your kidneys are not working fully, your doctor should adjust the dose to no more than 100 mg a day and monitor your serum magnesium levels. An excess of magnesium, though rare with healthy kidneys, can cause diarrhea, muscle weakness, and in extreme cases, cardiac arrest. But don't be alarmed. With a healthy kidney, it is very difficult to reach toxicity orally. When you manage to optimize your magnesium levels, we aim for a serum magnesium of 0.85 to 1 mmol/L. You will notice a big difference. You'll experience fewer cramps, more restful sleep, regular bowel movements, and what brought us here, much smoother sugar peaks after meals. Many of my patients tell me they can reduce their rapid-acting insulin by 2 to 4 units without their glucose spiking. This translates to fewer hypoglycemic episodes, more peace of mind, and a much better quality of life. The 4-week mini protocol. Now that you know the power of D3, E, and magnesium, I propose a simple 4-week plan to start feeling the benefits. Remember, always with your doctor's supervision. Week 1. We start with vitamin D3. Take 2,000 IU with lunch. Remember, take it with some fat for better absorption. If your last blood test showed you're 25, OD was below 20 ng/ml, severe deficit. You can go straight up to 4,000 IU. Now add the mixed vitamin E, 200 mg, this time with dinner. It is important that you start recording your fasting glucose every morning and your glucose 2 hours after your largest meal. Also, note any changes in your cramps, sleep quality, and general mood. Please do not change your hypoglycemic medication this first week. We want to see the effect of the supplements alone. Week 2. It's time to incorporate magnesium. Start with 200 mg at breakfast. If you notice slight diarrhea, don't worry, it's common. In that case, switch to the bisglycinate form or divide the dose, 100 mg in the morning and 100 mg at night. Continue to diligently record your glucose levels. Many of my patients start to see a drop of 10 to 15 mg/dl in their fasting glucose at this stage. If your levels are between 70 and 110 mg/dl and you start to notice hypoglycemia below 70, it is crucial that you consult your doctor to adjust your medication. I repeat, never do it alone. Week 3. If you have tolerated magnesium well, you can increase the dose to 300 or even 400 mg, always listening to your body. Review the records you've been keeping. If your blood magnesium is already above 0, 85 mmol/L, you can maintain the current dose. Similarly, if your vitamin D has already exceeded 30 ng/ml, you can reduce the dose to 1,000 IU daily for maintenance. Now incorporate a daily natural source of these nutrients. This could be 30 g of unsalted nuts or 2 small fatty fish fillets per week. Small changes that add up a lot. Week 4. The moment of truth has arrived. Repeat a complete blood test. Ask for glucose, HbA1c 25, OD, magnesium, calcium, and if you take anticoagulants, a coagulation test. With these results, if your numbers have improved, evaluate with your doctor the possibility of reducing your basal insulin dose by 2 to 4 units, or cutting 1 tablet of your oral hypoglycemic. Remember, the goal is not to stop medication suddenly, but to need the minimum amount compatible with an HbA1c below 7%, and most importantly, without hypoglycemia. Extra tips and FAQs. And here are some extra tips because health is holistic. Maintain optimal hydration, at least 2 liters of water a day. Your kidneys work hard to eliminate glucose and minerals, and water is their ally. Light strength exercise, such as using resistance bands for 10 minutes after each meal, is pure gold. It improves glucose uptake by your muscles without depleting liver glycogen. Monitor your weight. If you lose more than 2 kg in a month, it could be water and mineral loss, not just fat. In that case, adjust your potassium and magnesium intake with your doctor. If at the end of these 4 weeks your HbA1c has dropped between 0.3 and 0.5 points, and you also feel more energetic and less tired, we have won an important battle. If you don't see the expected changes, don't be discouraged. We'll review. You may need a finer carbohydrate adjustment or need to address stress, improve your sleep, check if your statins, which can sometimes raise sugar, are influencing things, or even look for hidden infections. The key to all this is never change 3 things at once. That way, we'll know exactly what works for you. If it is now crystal clear to you why vitamin D3 is the master key that turns on your metabolism, vitamin E is the antioxidant shield that protects your cells, and magnesium is the electrical regulator that makes everything work in harmony, then I have a favor to ask. Give this video a good like and share it with that person you know has been struggling with their glucose for years without seeing results. You could be giving them the information they need to change their life. Below in the description, you have links to the scientific studies I mentioned, so you can show them to your doctor with confidence. And a fundamental reminder, before adding any supplement to your routine, always check for possible interactions with your current treatment. Ready for the final stretch? Let's go through the frequently asked questions, FAQs. I know that when talking about supplements, many doubts arise, and that's normal. I have compiled the most common questions my patients ask me to resolve them right here. Can I take them all together? Absolutely. In fact, D3 and magnesium are great allies. Magnesium is necessary to activate vitamin D, and vitamin E even improves D's stability. The ideal is to split them throughout the day for better absorption and to avoid any digestive discomfort. For example, D3 with lunch to take advantage of the fats. You can divide the magnesium between breakfast and dinner, and E with dinner. That way, your body makes the most of them. What if I take metformin? This is an excellent and very common question. Metformin, although a very effective medication, has a known side effect. It can reduce the absorption of vitamin B12 and, to a lesser extent, vitamin D3. Therefore, if you take metformin, I strongly recommend that you check your B12 levels every year. If they are low, add a supplement of 500 text /mu $G a day of cyanocobalamin, or even better, 1000 text /mu $G of methylcobalamin, which is a more active and bioavailable form. In addition, magnesium will help counteract the constipation that metformin causes in some people, so it's a double benefit. Are they useful for type 1 diabetes? Yes, totally, but with some important nuances. Vitamin D3, for example, has been shown to improve the function of remaining beta cells in the pancreas and reduce inflammation, which is very beneficial. Vitamin E protects blood vessels from oxidative damage, which is critical in type 1 diabetes. And magnesium, by decreasing peripheral insulin resistance, is a great help, since many type 1 patients who experience chronic hyperglycemia are often deficient in this mineral. These supplements never replace insulin, which is vital, of course, but they can help reduce the total necessary doses and stabilize those annoying glucose variations, always under the supervision of your endocrinologist. Is there a risk of hypoglycemia with these supplements? It is a valid concern. However, the supplements alone do not cause fasting hypoglycemia in the sense that your pancreas or your injections do not exceed what is necessary. What happens is that by improving insulin sensitivity, your body becomes more efficient. This means that the same dose of insulin or your oral medication can lower glucose more. That is why it is so important that you closely monitor your numbers, and if you notice that your sugar is dropping too much, consult your doctor to adjust your medication. It is a sign that it is working. What about vitamin C? Vitamin C can be added, yes, about 500 mg a day, as an extra antioxidant. However, the scientific evidence for its direct and significant impact on diabetes control is more modest compared to D3, E, or magnesium. It is not usually a priority unless you have a demonstrated deficit or if you suffer from slow wound healing, where it can be very helpful. When will I start to see results? Patience is a virtue, but the results are usually gratifying. In about 10 to 14 days, many patients already notice less fatigue and a reduction in cramps. In 4 to 6 weeks, it is common to see an improvement in fasting glucose, and the most significant impact on HbA1c is usually observed at 3 months. If after a month you don't see any changes, don't give up. Review the doses, make sure you are consistent with taking them, and if all that is in order, explore other possible causes of insulin resistance with your doctor, such as sleep apnea syndrome, chronic stress, the use of corticosteroids, or even hidden infections. Can I open the capsules and mix them with something? Good question. The vitamin D3 and E capsules, which usually come in an oily base, yes, you can open them and mix them with a yogurt, a smoothie, or a little oil. Magnesium, if you buy it in powder form, sometimes has a slightly metallic taste. I suggest mixing it with water, a splash of lemon, and a little stevia to make it more pleasant. If you use magnesium chloride, which is quite salty, you can prepare 1 liter of water with about 2 g and take 100 ml in each serving. That way, you distribute the salinity. Is there an age limit for taking these supplements? Not at all. Even patients over 80 years old respond very well to these supplements. What I do recommend is to start with half the suggested dose and increase it progressively, always observing how you feel. If you have severe kidney failure, it is vital that your doctor adjusts the magnesium dose and monitors your potassium levels, since the electrolyte balance is more delicate. Do I need a medical prescription to buy them? No, you do not need a prescription to buy these supplements, as they are classified as food supplements. However, my advice is to look for trusted brands that have quality seals like GMP, Good Manufacturing Practice, or USB, United States Pharmacopoeia. Avoid those products that mix 20 ingredients in a single capsule. It is very difficult to dose each component correctly, and they increase the risk of unwanted interactions. Purity and quality matter a lot. What if I do intermittent fasting? You can maintain your intermittent fasting without any problem. These supplements do not break the fast if they contain less than 5 kilocalories. The ideal is to take vitamin D3 and E with your first meal of the day to take advantage of the presence of fats. Magnesium, on the other hand, you can take even on an empty stomach, although some people get slight diarrhea if they do it without food accompaniment. Listen to your body. There you have it. Now that you know how vitamin D3, natural vitamin E, and magnesium can be your great allies for lowering your sugar, improving your energy, and protecting your long-term health, it is time to take action. Don't just keep this information in your head. Download the dosage chart that I have left for you in the video description, take it to your next medical visit, and ask your doctor this question. Doctor, my numbers have improved with these supplements. Could we adjust my medication? And if this video has been useful to you, please subscribe to my channel to not miss any more at-home endocrinology tips and tricks, always with a scientific basis. And of course, share this video in your diabetes group with your friends or family. Sometimes the best gift we can give is valuable information that can prevent a scare and improve the quality of life of someone we love. Until next time, take good care of yourself and don't stop monitoring your sugar. Please subscribe to the Healthy Life at 60 channel.